Good morning, good afternoon, or good evening, wherever you are in the world. It's truly an honor and privilege to be with you today. My name is David Bernstein. I'm a chief resident in the Harvard Combined Orthopedic Residency Program and a former senior researcher at Harvard Business School. I'm thrilled to be joining all my colleagues across the world and presenting a talk as part of the Research in Global Orthopedics program through the Harvard Global Orthopedics Collaborative. My talk today is entitled From Survey to Solution, Leveraging PROMs and Clinician Survey Data in Health Services Research to Drive Real Change. These are my disclosures. None are specifically relevant to today's talk. If we take a step back, there's a global orthopedic challenge that we all recognize. There's high burden, variable care, and limited financial resources. In fact, musculoskeletal conditions, or MSK conditions, have the fourth greatest impact on the health of the world's population. There's disparities in care quality and access that exist within and across countries, and MSK diseases remain underfunded, despite high economic burden and human toll. So the ongoing challenges demonstrates the need for health services research. So one big question is, what is health services research? In short, health services research is a multidisciplinary field that studies the organization, delivery, and clinical results and financing of healthcare systems to improve patient health and well-being. A more complete definition is seen here on the screen. But why is it important? I would argue that health services research provides the data and findings that are really necessary to achieve goals that we are all after, whether that's more funding for musculoskeletal care, improving patient outcomes experience with better system design, etc. It's that final puzzle piece to achieve that goal and is critical area of scholarly inquiry. So within the broad scope of health systems research, and it is quite broad, there's two areas of scholarly inquiry that may be good, quote unquote, first steps towards needed progress. One is the routine collection and assessment of patient-reported outcome measures, or PROMs, in different clinical settings and cultural contexts, and clinician surveys aimed at assessing key elements of musculoskeletal care delivery. So let's start with PROMs, or patient-reported outcome measures. So what are they? PROMs are questionnaires that collect health outcomes directly from the people who experience them, patients. They measure domains such as function, pain, and quality of life. And these are the outcomes most often sought by patients receiving orthopedic care. It really allows us to put the patient front and center in their care, making sure that we measure what matters most to them. In this article at the bottom of the screen, I highlight alongside many remarkable co-authors why outcomes measurement in global hand surgery, as an example, is critically important. And frankly, I think it's important across all of orthopedic and musculoskeletal care. But there are tips and tricks to high-quality science using PROMs. We must use validated PROMs designed to capture the domain of interest, for example, function. We should use PROMs that are responsive and can differentiate patients. For example, if a patient undergoes a surgery that leads to them having much better functional outcome, the PROM should be able to easily demonstrate and show the improvement in function from pre to post-operative timeframes. We need to use PROMs that reduce burden on patients as well as physicians and their care teams. And whenever possible, we should ensure that PROMs utilized are created and validated using a generalizable patient sample that fits the cultural context. It's also important to note that clinician insights add important context and are needed to optimize orthopedic care delivery. Well-designed clinician surveys can be used to gather valuable data on practice, knowledge, resources, and systems. Examples of insights gained from good clinician surveys include resource assessment. You can quantify and compare the availability of essential resources in different contexts. Educational assessment. You can examine adherence to evidence-based protocols to identify possible knowledge gaps and room for improvement. And pathway assessment. You can understand how patients access musculoskeletal care and identify barriers and issues that need to be addressed, especially in rural and or underserved areas. But there's also tips and tricks to high quality science using clinician surveys. You want to ensure that the team knows the results that are used for learning and quality improvement, not for penalization. You want to reduce survey burden as much as possible. As we all know, clinicians around the world are being asked to do more with less, and increasing that ask by having long surveys can be quite burdensome and lead to poor completion percentages, and then can bias our findings. You want to ensure that the sample of clinicians surveyed are representative of the entire group of interest, and you want to clearly explain how the findings may be able to help clinicians and their patients. This is critical, and it's likely to lead to improved completion percentages and then findings that are more generalizable and can better impact policy and system changes. The types of questions that can be answered with PROMs and or clinician surveys can help guide patient care, support expectation setting, and better align resources. Examples of possible study questions or study topics include the following. Does procedure X or Y lead to better clinical outcomes? Historically, we've measured clinical outcomes such as mortality, and while important, many patients want to better know how it's going to impact their function, pain, or quality of life. Another question is, does standardization of care pathway X improve clinical outcomes? And you can assess that both pre and post surgery to have a more complete picture. What are the outcomes of specific patient population undergoing a specific procedure unique to a certain context? You may live in an area of the world where there's a certain condition that is much rarer elsewhere. That offers an incredible opportunity to study that condition in detail and enlighten the world into what are the outcomes that can be expected using different techniques or different surgical approaches. Another key question is, do we need as much routine follow-up imaging or other studies following a given procedure to ensure optimal clinical outcomes? In resource-strapped areas, it may be better for us not to have follow-up, for example, at 2, 6, 12 weeks. Instead, could we do 2 weeks, 3 months, and then follow up as needed? And take the resources that we would otherwise use at the 6-month and 12-month or 1 year time frame and put it towards caring for other patients. When it comes to PROMs research, translating, validating, and ensuring concurrent validity of various PROMs in different contexts is critical. And if it hasn't already been done, it's an amazing opportunity for people on this call around the world to really dive into PROMs and create the patient-reported outcome measures that are best for their cultural contexts. And then designing PROMs collection efforts and assessing their success or failure is critical. Even in high resource settings, PROMs collection can be difficult. We can learn from one another using health services research to help guide our changes in our own collection efforts. And then hopefully the world can collect PROMs and lead to different registries that we can then have a better sense around the world of different procedures and the outcomes of patients with different conditions in different contexts. Ultimately, by linking clinician survey data, for example, practice patterns, and clinical outcomes, this can then lead to targeted policy efforts that are then possible and weren't possible before, a huge benefit of health services research. Health services research offers great potential to make a difference, but challenges with this type of research, including when focused on PROMs and or clinician surveys, are present, and they really should be acknowledged. Some of these include language and cultural adaptation challenges. As we discussed briefly before, PROMs and surveys must be linguistically and culturally validated to ensure questions mean the same thing across diverse populations. There are always literacy concerns, and low literacy rates in some regions require alternative data collection methods. For example, interviewer-administered surveys versus giving the survey to an individual and then just having them fill it out, either electronically or via pen and paper. There is always data infrastructure limitations or concerns. There can be a lack of reliable electronic data collection and secure storage systems, especially in resource-limited settings. And clinician engagement challenges. As we briefly touched upon earlier as well, burnout and high clinical load can make survey completion difficult for busy global surgeons. And if we take a step back, patients themselves are also quite busy. And if it's unclear how a patient-reported outcome measure is going to be used and how it can be helpful to them and their care that they're receiving, they also may not be willing or feeling a desire to complete the PROM. And then all of the data that could be of value to improve patient care, to guide clinical decision making, and to improve policy initiatives are not available. But these challenges, importantly, are opportunities for research. How do we adapt certain PROMs? In low literacy areas, how can we better improve the collection methods? And how do we improve literacy? Data infrastructure. Can we design systems to collect PROMs in different settings and challenging areas? And clinician engagement. How do we prove to clinicians and patients that these data are incredibly important for the future of healthcare and musculoskeletal care? So I'd like to summarize and make a call to action. Research is critical to solving problems, driving innovation, and advancing orthopedic care across the globe. Health services research is a crucial type of research that helps deliver data that can be used to drive systemic changes on a large scale, ensuring more equitable resource allocation and continued quality improvement. Health services research can have local, national, or international impact, and all are important. I encourage everybody on this call to seek out opportunities to conduct health services research. Reach out to mentors who have done health services research. Ultimately, many people around the globe are looking to collaborate to drive a positive change in musculoskeletal care, and health services research can help us achieve that shared vision and goal. I want to thank everybody for their attention during my talk. Here's my contact information. Please reach out at any time if there's any questions that arise. And I also want to take a moment to thank the leadership team and the entire team at the Harvard Global Orthopedics Collaborative for putting on this incredible program. As always, they deliver exceptional educational opportunities, and I'm grateful to have been asked to participate in this program. Thank you again.